name is Kevin Sterling. Today I'm here to talk a little bit about major depressive disorder, more commonly just simply known as depression. Depression is a disease that many people do not fully understand. After multiple bouts with depression, I've had to do extensive research, and now I have a much better understanding as to what causes depression and what the disease can do to those who have it and what effects it has on those around them. I will be starting at the beginning to let everyone know what depression really is, followed by the risks that come with the disease and what can be done to help by those around us. I will also add in the many treatment opportunities that are available and the risks that come with those different options. I would just like to get the word out to give everyone a better understanding of what depression really is. By bringing forth the information about the disease, hopefully people that may be suffering in silence can understand that they didn't do anything wrong to bring this on, and that there are many people out there who can help them and to let them know that they are not alone. What really is depression? Many people that suffer from depression say that it feels like a dark curtain coming down over their everyday life. Depression takes away all of your energy and can cloud your ability to think clearly. Those with depression can be very irritable and would rather be secluded from the rest of the population rather than dealing with everyday life. Depression, though, is much more than somebody just feeling bad for a little while. Depression results from a chemical change in the brain by neurotransmitters. This area of the brain becomes off balance with a shortage of either norepinephrine or serotonin. It alters the way the person looks at life in general. Some key indicators to look at for somebody with depression. Some of the key things to look at, those around you that may be suffering from depression, could be either a lack of energy, sleeplessness or sleeping much more than normal, lack of interest in activities that would normally excite the person, and increased irritability. If you see one or more of these symptoms coming on, then you could be seeing the early signs of depression. What causes depression, though? There is really no single thing that causes depression, but there are many different things that help to contribute to bring on this disease. The biggest contributor of bringing on the disease would be a person's family history. Genetics have a vital role in how a person functions, and depression can run in families for generations. Trauma and stress, along with a person's overall personality, also can contribute to bringing on depression. With overwhelming stress or a very traumatic event in a person's life, that person can start to feel as if nothing can go right for them, and their thought process begins to change and send them into a downward spiral. Another thing that can contribute to bringing on depression could be a serious medical condition. Having a serious medical condition could definitely change a person's way of thinking and put serious doubt about life and why things happen. Medical conditions could give people a negative outlook on life and change their thoughts on the value of life in general. When it comes to how depression really affects different people, a lot of it comes down to each individual person and the person's gender and age. Women are more than twice as likely to suffer from depression than men. With the changes in hormones brought on by events such as puberty and pregnancy, those changes bring on more of a chance for depression than anything else. With men, even though they are less likely to suffer from depression, they are also more likely to go undiagnosed. With going undiagnosed, depression tends to grow worse, which gives men a much higher suicide risk associated with depression as well. The worst case of going undiagnosed, though, would be with elderly. Elderly associate depression with the normal signs of aging, and therefore it goes undiagnosed more than any other group. Elderly people should be watched especially close to make sure that depression is not setting in. There are a couple different options that can be used to treat depression. You have prescribed medications and you have therapy, or you could always have a combination of both. Therapy is by far the safer of the two methods, and it can work if the person fully opens up about what the problems really are on hand. Although it is the safest method, it is also the one that could take the longest to work, and throughout treatment, those close to the patient should keep a close eye on them to make sure that the symptoms do not continue to grow worse. The more popular method that is easier for people to work with is medical prescription. Once talking to a doctor and seeing exactly what medication should work best, a single pill a day can begin to help. The biggest problem with taking medications, though, would be the many side effects that could happen. Some of the common side effects include nausea, insomnia, various sexual side effects, in some rare cases seizures, and also medications could also increase suicidal risk. In conclusion, depression is a disease that should not be taken lightly. 16% of the American population will suffer from this disease at some point in time in their life. So if you see someone suffering from any of the key indicators, or suspect that they may be having problems, talk to them and encourage them to seek help. Depression is not something that is just going to go away. Professional interaction is required to help bring life back to normal. Thank you.